Welcome to the Holistic Psychiatry Podcast. I'm Courtney Brown Snyder, a physician and holistic adult and child psychiatrist. In this episode, I thought I would share some of my journey to becoming and continuing to become a holistic psychiatrist. I've shared parts of my path in other episodes, but as I work on a book, I thought I would put some of this together for the introduction and would share that with you here. The journey of 1,000 miles begins with a single step, says Lao Tzu. I don't recall that step. Maybe it was when I first asked for help for my daughter, or maybe when I decided to stop asking, when I realized that conventional medicine did not have the answers for us. Either way, my experience into illness and healing forced me to let go of many assumptions and expectations I had about the world, about life, and about myself. My hope in this book is to share what I've learned so someone else won't have to search as long as I did. Though at times frustrating, the seeming snail's pace of such a pursuit, there are many who will never look beyond what is in front of them, many who will never cross paths with those who might point them in unexpected directions, and many who, when given leads, will never pursue them. If you are listening to this or reading this, perhaps you too are a seeker. Psychotherapy and medication. After completing training in general psychiatry and then child and adolescent psychiatry, and working 1 year in community mental health clinics in southern Indiana, I started a private practice in Louisville, Kentucky, where I provided psychotherapy, including family therapy, and if needed, I would prescribe psychiatric medications to those I was seeing in therapy. Attachment. Feeling unable to help a handful of children in my practice who had been adopted from international orphanages and who thus had early and severe trauma and attachment-related issues, I sought out training was then Dr. Gregory Keck's Attachment and Bonding Center of Ohio. This education and work was personally and professionally transformative. I went on to develop a subspecialty in treating families with adopted children from international orphanages and foster care. It was through this work teaching parents how to provide an attachment experience that their children had missed in earliest life that I realized I wanted to be a mother. Chronic stress. When my daughter was born, I closed my practice to be at home with her. Though a deeply meaningful time in my life, it was also a time of chronic and high stress. Much of her early years would be clouded by her recurrent ear infections, allergies, gastrointestinal symptoms, and frequent changes in her speech, cognition, memory, and personality. This was along with my best described symptoms of fibromyalgia and chronic fatigue, which included neck pain, stiffness, episodes of nausea, dizziness, palpitations, headaches, and sinus infections. My daughter's cognitive changes, however subtle to others, and my intermittent neurologic symptoms, which began to affect my ability to climb stairs, made me anxious, at times very anxious. Demoralization. While I can't speak for the doctors we saw, I suspect many concluded that we both suffered from my being an overly informed, neurotic physician. Though shame, isolation, and growing distrust of those we expect to help us can be the norm when it comes to complex illness, most of us don't realize this until we're on the other side. Despite the lack of validation, I always knew that whatever was going on with each of us was systemic, affecting the brain and body, inflammatory in nature, and related to shared genetic vulnerabilities. What I didn't realize was how our symptoms also related to shared environmental exposures. I also knew, had I been one of those doctors before learning more, I would have concluded the same. Inevitably, I chose a different path. As the Quakers say, way closes, way opens. I'm grateful to many of those we saw early on, but for their lack of answers, I would not have relentlessly delved into the latest research on the gut-brain axis, the microbiome, epigenetics, autoimmunity, inflammation, oxidative stress, metal metabolism, nutrient deficiencies and overloads, and neuroplasticity. All of this understanding has become the foundations of the psychiatric assessments and treatments that I offer in my practice, and much of this information will still take many years to make into mainstream medicine. My experience of being sick, which became apparent by the age of 41, and having a sick 3-year-old child, and the empathy that inevitably followed, has driven me to share this information over the years, online, and now in a book, Microbiome. Without the internet, I wouldn't have crossed paths with many of the teachers who led me to my current understanding about brain-related disorders. Many of those individuals became experts out of a practical need to help their child and/or themselves. There was the child psychiatrist and author who helped autistic son with a candida diet and whose work started me down the path of the gut-brain axis. Then there was the functional medicine doctor near Asheville. His wife, also a physician, recommended we look into the work of a doctor in England who cured her son's autism with diet, now the GAPS diet, and which led me to the research on the microbiome. Dietary changes resulted in big shifts, nutrient imbalances, low zinc, undermethylation, and oxidative stress. I found my now friend and colleague, Dr. Judy Saphir, a holistic psychiatrist in the Boston area, who had already been incorporating nutrition into her work for some time. I reached out to her not for medical advice, but for advice starting a holistic psychiatry practice. She mentioned the physician training at the Walsh Research Institute in advanced nutrient therapies, which we both attended. At the time, it was the second conference they'd offered here in the U.S. They'd been training physicians internationally prior to that. I didn't realize when I took that training how effective and important the work of Dr. William Walsh in methylation, metal metabolism, and nutrient deficiencies and overloads would be in my own work as a psychiatrist, nor did I realize how relevant this understanding would be to the roots of my and my daughter's symptoms. Aside from completing 2 trainings, I had the pleasure of sitting down with Dr. Walsh for lunch and interviewing him about his fascinating story, his discoveries, and the future of nutrient-based psychiatry. I have a previous episode on this and many of the topics that I'm touching on in this episode today. In 2021, Dr. Walsh invited me to teach at the advanced training for the Walsh Research Institute. There, I discussed the intersections between mold toxicity, mast cell activation, EMF sensitivity, and the Walsh nutrient imbalances. Mold toxicity and mast cell activation. Though my daughter and I had made significant progress over the 10 years I was away from practice, it wasn't until 3 years later that I came to realize that the deeper root cause of our symptoms, including some residual symptoms we were both still having, was mold toxicity, and in my case, mast cell activation from mold. Mast cell activation is an exaggerated immune response that can result in high reactivity to various foods, supplements, even things like exercise, stress, and weather changes, among others. It was 2017 when the prevalence of mold toxicity and mast cell activation were just starting to become more fully appreciated in functional medicine. This led me to the work of Dr. Neil Nathan, a leader and pioneer in the understanding and treatment of mold-related illness and complex chronic illness. Addressing hidden exposures in our home and my office, which if you've dealt with this, you know that's no easy task, and treating mold toxicity, which takes time, helped us both significantly improve, though we both did end up dealing with some re-exposures from my work and my daughter's school settings. I quickly realized that mold toxicity was at play for many of the patients I was seeing in my practice. After the Walsh protocols, addressing mold toxicity became one of the most powerful tools in my toolbox. I went on to do a mentoring program with Neil Nathan and now feel fortunate to be co-leading groups with Neil Nathan to help support practitioners who are treating patients with complex chronic illness. RCCX. How could someone such as myself be hit with nutrient imbalances, mold toxicity, mast cell activation, and such a range of symptoms and conditions? I haven't even mentioned the interstitial cystitis, ovarian teratoma, visual migraines, and more that I've gladly put behind me. This constellation of symptoms and conditions began to make more sense when I came upon the relationship between mast cell activation and hypermobility. Though I didn't have Ehlers-Danlos, I was always someone who was hypermobile, and in fact this led me to do gymnastics for many years when I was young. Recognizing this intersection, I discovered the work of Dr. Sharon McGlathery, whose complex health history was similar to my own. Her insights are laid out in the powerful though complex RCCX theory that explains well why those of us who fall on the hypermobility spectrum can, under certain circumstances, experience a range of mental and physical health conditions. It also explains the family history for many individuals who have a wide range of chronic and complex conditions. It also explains why some seem to be wired for danger from the start, and explains the overlaps between giftedness, mental health issues, and again, complex chronic illness or conditions such as mast cell activation, chronic fatigue, autoimmune conditions, chronic inflammatory response syndrome, and more. Structural issues. It was from this understanding of RCCX that many of my intermittent neurologic symptoms also started to make sense. My symptoms, I came to realize, were triggered by the position of my neck, which was impacted by the type of chair I was sitting in. For example, if I was sitting in a car, I would have more symptoms. If I was sitting on a soft piece of furniture, I would as well. If I slept without my neck supported, I would have symptoms. The combination of a displaced atlas, this is the highest vertebra of the neck, upper cervical instability, so laxity of the joints of the upper part of my neck, which was in part likely due to chronic neck trauma from gymnastics, in addition to a congenital fusion of two of the cervical vertebrae, and mast cell activation causing inflammation, were the seeming causes of a range of cranial nerve symptoms that were part of my condition, which included intermittent problem swallowing, facial twitching and numbness, nausea, ringing in my ears, clenching my jaw, blurred vision, and dizziness. Getting my head on straight with the help of an Atlas orthogonal specialist and learning to keep my head on straight through the help of a physical therapist was a huge step in lowering my pain and stiffness. Improvement in my cranial compliance, so this is how much our skull gives, was improved significantly with a physical therapist, and this allowed my improvements to stick so that I didn't have to keep going back to get my atlas addressed. And this is thanks to local colleague, Dr. Patrick Bray. Hormones. In parallel with the evolution and improvement in my health were hormonal changes. Aside from the development of hypothyroidism during mold toxicity, I was also in perimenopause. What that means is different for all of us, especially those of us seemingly impacted by the RCCX gene module. One of the genes in that module affects hormonal pathways and can result in high progesterone, which can impact the connective tissue. Connective tissue isn't just about our joints and causing things like upper cervical instability. It's also about our blood vessels and can contribute to pooling of blood in the legs, and with that, drops in blood pressure. Weak connective tissue can also be a player at our gut-blood barrier and result in increased gut permeability, and even at our blood-brain barrier, which is supposed to keep things like heavy metals and microbes out. EMF. Despite deep gratitude for how my evolving education was helping us and my patients, neither my daughter and I seemed healed. By this time, my daughter was 15 and I was 53, After moving to a new house in Florida, shortly before COVID, we both deteriorated and developed new symptoms, including burning skin, for me of the face and hands to mid-arms, from the screen and wireless keyboard. We had bought a new house to avoid mold. We didn't appreciate, however, that it was a smart house and had smart technology that we weren't even using. Unknowingly, we were exposed to much higher electromagnetic fields than we ever had been. Aside from a booster, there was smart technology on everything from the doorbell, thermostat, refrigerator, and sprinkler system. At the time, buzz about EMF was making its way into the functional medicine online discussions that I was part of. I reached out to a building biologist, Mary Ann Tierney, to learn about EMF for my patients, not even realizing that might be an issue for us. With her help, we began to measure and lower our exposure to electromagnetic fields. The results were quick and dramatic. I had felt like I reclaimed my brain from many years earlier, before there was so much wireless technology. As with mold, not everyone is susceptible to the same degree. Those of us who have or have had a degree of brain injury from trauma or toxicity, along with particular genetic vulnerabilities, appear most at risk. I suspect that I had sensitivity before that house, but it certainly took it to a higher level. Many of us who have EMF-related symptoms find that once we lower exposure long enough, the sensitivity settles down. Mold toxicity fuels this as well, and as it turns out, that particular house, despite being new, did have mold. Right brain. Along the road of this relentless pursuit to heal myself and daughter, I lived largely out of my left brain. While it may have helped me find answers, it also added significantly to chronic stress, which wasn't helping. At my lowest point, I let go of the reins and accepted that pain and fatigue may just have to be part of my life. This letting go created a major shift in the amount of stress I was carrying. It was then that many of my answers that I've talked about started showing up. Those who helped me grow my right brain, and thus my heart, compassion, ability to let go, trust my intuition, have my feelings, and know that my answers would come, are many, including writer Tosha Silver, philosopher and poet John O'Donohue, Leonard Cohen, and the psychiatrist Dr. Ian McGilchrist, whose book The Master and His Emissary helped me understand that my unchecked left brain was making me sicker. Support. By no means was I traveling alone, nor would my or our daughter's healing be possible without unending support of my then husband, Marty. It can be easy to forget that even if we are the ones that are sick, with whatever our symptoms are, those who love us are inevitably on a parallel road and enduring their own suffering. There's the loss of the life they expected, the fear and chronic stress, the moves, the expense, and the isolation that can come to families living with complex chronic illness. As with psychiatric illness, with complex illness, you don't necessarily look sick. If you do, there would likely be more understanding and support from others outside your immediate family. Add to that the difficulty being around people when your body and mind are in shutdown or in a state of fight or flight. Gratitude. Though my challenges and my daughter's could have been much worse, I wouldn't wish them on anyone, except maybe someone who wants to overhaul their entire way of living, or who wants to find their deepest purpose, or who wants to learn about the rapidly evolving scientific research that will eventually change the way we approach mental health and human health. As Kierkegaard says, life must be lived forward, but can only be understood backwards. By the time of writing this, my daughter is in her second year of college. I continue to see patients, provide non-patient consultations, teach and write to get the information about the root causes of brain symptoms and complex chronic illness out into the world. My wish for anyone listening is that your pursuit of health, happiness, and whatever you seek leads you to peace and a desire to help others traveling their 1,000 miles. Thank you for listening. If you'd like to receive these episodes in your mailbox each week, please consider subscribing at CourtneySnyderMD.com, where I also have information on a mentoring group that's available to physicians, nurse practitioners, and physician's assistants. I look forward to connecting with you in a future episode. Until then, take care.